Welcome to Chapter 43, Sleep. Keep in mind that proper rest and sleep are as important to health as good nutrition and exercise. Physical and emotional health depends on your ability to fulfill these basic human needs, and individuals do need different amounts of sleep and rest. And without proper amounts, your ability to concentrate, make judgments, and participate in daily activities will decrease. People's irritability does increase. If you can identify and treat patients' sleep pattern disturbances, then you help people meet an important goal. To help patients, you need to understand the nature of sleep, the factors influencing it, and patients' sleep habits. People experience cycle rhythms as part of their everyday lives. The most familiar rhythm is the 24-hour day-night cycle called the circadian rhythm. It's actually derived from a Latin term meaning circa. There is an SCN nerve cell in your hypothalamus that controls the rhythm of your sleep-wake cycle, and it coordinates this with other circadian rhythms in your body. The circadian rhythm influences the pattern of major biological and behavioral functions. The predictable changing of body temperature, your heart rate, blood pressure, hormone secretion, sensory acuity, and mood depend on that 24-hour cycle. All persons have biological clocks that synchronize their sleep cycles. This explains why some people go to sleep at 8 p.m. and others don't go to midnight. And different people function best at different times of the day. Failure to maintain a sleep-wake cycle will negatively influence everyone. Sleep is associated with changes in your peripheral nervous, endocrine, cardiovascular, respiratory, and muscular systems. Specific physiological responses and patterns of brain activity identify each sequence. Instruments such as your EEG, which measures electrical activity in the cerebral cortex, your EMG, which measures your muscle tone, and an EOG, which measures eye movement, provide information about sleep. The major sleep center in your body is, of course, your hypothalamus. It secretes things called orexins that promote wakefulness and rapid eye movement sleep. There's also prostaglandin D and tryptophan and growth factors that can control sleep. Researchers believe that there's an ascending reticular activating system, they call it RAS, located in your brainstem that contains cells that maintain your alertfulness and wakefulness. This RAS receives visual, auditory, pain, and tactile sensory stimuli. Activity from the cerebral cortex also can stimulate the RAS. This is a case study. If you read through it, it's about a gentleman who's 82 years old, lives with his wife. His wife is very concerned this gentleman's not sleeping. He tells his wife has trouble falling asleep at night, and once he does fall asleep, he reawakens frequently during the night. And I want you to kind of think about this. What concerns do you have for this patient? How would you assess his sleeping pattern? What do you think we need to do for him? The normal sleep pattern for an adult begins with a pre-sleep period, during which the person is aware only of that gradually sleepiness. This period normally lasts 10 to 30 minutes. However, if you have difficulty falling asleep, it can last an hour or more. Once you fall asleep, the person usually passes through 4 or 5 complete sleep cycles, each consisting of 4 stages of something called non-rapid eye movement and a period of rapid eye movement sleep. People usually reach this REM sleep about 90 minutes into the sleep cycle. 75 to 80% of your sleep is actually in the non-REM cycle. These stages, this sleep becomes more fragmented with aging. The people tend to spend more time in the lighter stages. During sleep, the heart rate falls to 60 beats a minute or less, and that benefits your cardiac system. Other functions are decreased during sleep, including respirations, your blood pressure, your muscle tone. Your body needs sleep to routinely restore your processes. During the deep, slow wave sleep, the body releases human growth hormone for the repair and renewal of epithelial cells, protein synthesis and cell division for renewal of tissues such as skin, bone marrow, gastric mucosa, and it is especially important for children to get. They have more stage 4 sleep. Another theory about the purpose of sleep is that the body conserves energy during sleep. Your skeletal muscle relaxes progressively No muscle contraction preserves chemical energy. Your basal metabolic rate conserves your body energy supply. A loss of REM sleep leads to feelings of confusion and suspicion. There are dreams that occur during the REM and the non-REM sleep. The REM sleep dreams are more vivid and elaborate, and some believe that they're important to your memory process and your ability to deal with stress. The ability to describe your dream is significant sometimes for some people when they have concerns and fears. Respiratory disease, such as COPD, emphysema, asthma, allergies, or the common cold, can often interfere with sleep. There are connections between heart disease, sleep, and sleep disorders. Sleep-related breathing disorders are linked to increased incidence of nocturnal angina, which is chest pain, increased heart rate, EKG changes, high blood pressure, and a risk of heart disease. Nocturia can disrupt the sleep cycle. That's when you get up and you tinkle at night, nocturia. Restless leg syndrome can occur before sleep onsets. Symptoms include recurrent movements of the feet and leg. People can feel like an itching sensation deep in the muscle. Relief comes from moving the legs and it ends up preventing relaxation and sleep. Sleep disorders are conditions that, if untreated, cause disturbed nighttime sleep, can result in insomnia, abnormal movements, and excessive daytime sleepiness. And there are many adults in the United States who have significant sleep problems. They call it hypersomnolence. When you're somnolent, you're tired. That's a word for tired. Here's some wonderful vocabulary words. Insomnia. Insomnia is the most common sleep disorder. It's a symptom you experience when you chronically have difficulty falling asleep. You can also have sleep apnea. It's a disorder characterized by a lack of airflow through the nose and mouth for 10 seconds or longer. There's actually 3 types listed in your book: central, obstructive, and mixed. The most common form is obstructive. Obesity and hypertension tend to contribute to that. Central sleep apnea is something in the brain that involves dysfunction on the center of the brain. There's another disease on here, narcolepsy. There's a word on here you should know. It's called cataplexy. People with narcolepsy don't necessarily just fall asleep. A lot of them during the day, they can feel overwhelmed, sleepiness, and fall asleep, or they can have sudden muscle weakness if they have emotions during the day. Sleep deprivation, I think everyone pretty much can say that they understand what that one is. The very last one, parasomnia, are sleep problems common in children like sleepwalking, night terrors, nightmares, bedwetting, tooth grinding. Here's a quick quiz for you to take a look at. The answer is D. I want you to think a little bit about this. The term rest does not imply inactivity. When rested, people experience feelings of rejuvenation. They feel refreshed, able to carry out their activities of daily living. Illness and unfamiliar healthcare routines can affect the usual rest and sleep patterns of hospitalized patients. It's important to allow patients periods to rest. Nurses frequently care for patients on bed rest to reduce physical and psychological demands on their body. However, these people do not necessarily feel rested. Many of them have emotional worries that can prevent relaxation. You must always be aware of a patient's need for rest. Lack of rest for long periods causes illness or a worsening of a current condition. Here's a list of human beings' sleep duration and quality across the lifespan. In adolescence, shortened sleep time often results in excessive daytime sleepiness. It can lead to decreased performance in school. Pregnancy can increase the need for sleep and rest. Many pregnant women describe a lot of variations when they're sleeping. In middle age, the amount of stage 4 sleep begins to fall. It's a decline that you see with advancing age. A lot of changes in their circadian rhythms. Something to kind of think about when you're talking to people. Here's a quick quiz. I'll let you guys chat with me in class this upcoming week and let me know what you think the answer is. I want to talk a little bit about factors that influence your sleep. A number of factors affect the quality and quantity of sleep. There is often several factors contributing to sleep disorders. Sleepiness, insomnia, fatigue often result as a direct effect of commonly prescribed medications. Emotional stress can cause a person to be tense and lead to frustration when sleep does not occur. Stress can cause a person to try too hard to fall asleep, to awaken frequently during the sleep cycle. Older patients frequently experience loss that leads to emotional stress. Examples include retirement, physical impairment, or the death of a loved one. A lot of depressed people have sleep issues. Good ventilation is important for restful sleep. The size, firmness, and position of the bed can affect the quality of sleep. If you usually sleep with another individual, sleeping alone can often cause you to wake up. On the other hand, sleeping with a snoring bed partner can disrupt your sleep. You have to follow good eating habits and watch your weight. A weight gain can contribute to poor sleep. Here's another quiz for you to take a look at. We'll talk about it when we talk on Saturday about the answer. Throughout the PowerPoints that we get, they have case studies. This is about Anna, a 23-year-old nursing student going to a nursing home. She has some experience. She's worked in a few centers, and she's going to be caring for a patient over the next 4 weeks. As Anna prepares to conduct an assessment of Mr. Murphy, she knows it is important to consider how sleep is altered in older adults. Because they typically have less deep sleep and more awakenings, it's important to consider what factors in that nursing home may be disrupting this man's sleep. Anna plans to include Mr. Murphy in the assessment and learn more about, it's Mrs. Murphy. They're going to include Mrs. Murphy in to talk with Mr. Murphy. Think about that. When you assess the family and the culture and everything about a person. And I want you to think about, is there anything else? Is there any other factor that Anna should take a look at before she makes this assessment? Mr. Murphy answers these questions from Anna, and here are his responses. Mr. Murphy says it's probably taking him an hour to get to sleep. Mr. Murphy replies, I can't get to sleep here. Something's always going on out in the hall. Mr. Murphy estimates he got about 4 hours of sleep last night. He estimates it was the worst night of sleep he ever had. At home, Mr. Murphy would sleep from 10 p.m. to 6:30 a.m. He said that he rarely had trouble getting to sleep at home, and his wife said he liked to listen to music. Mr. Murphy said he is having some pain from osteoarthritis and having trouble changing positions. Mr. Murphy yawns frequently during Anna's assessment and shifts his position in his wheelchair frequently. There are two effective subjective measures of sleep. One called the Epworth Sleepiness Scale, and another one's called the Pittsburgh Sleep Quality Index. It's a system where patients can give a number so you can better understand what they're trying to tell you. There's actually just a brief subjective method. You can ask them to give it a numeric scale with 0 to 10 sleep rating. If you suspect a sleep problem, assess the quality and characteristics of sleep in greater depth by talking to your patient and asking them to describe the problem. This will include recent changes in sleep patterns, sleep symptoms experienced during waking hours, use of sleep and other prescribed or over-the-counter medications, diet, intake of substances such as caffeine or alcohol that may be influencing sleep, and any recent life events that may be affecting mental and emotional status. If the patient's sleep is adequate, you can assess his or her usual bedtime, normal bedtime ritual, preferred environment for sleeping and rising time. Make sure if a patient has a sleep problem, you conduct a complete sleep history. Diagnosing sleep problems depends on identifying the factors that are impairing the sleep. Remember, open-ended questions help a patient describe a problem more fully. You have to be specific and find out what is going on with the person's sleep problem. Remember to pay special attention to children's bedtime rituals. Some young children need a blanket or a stuffed animal. In your assessment, learn if a patient is experiencing any changes in their lifestyle or what their occupation is. Anna learns that Mr. Murphy's osteoarthritis pain is a factor contributing to his sleep disturbance. His immobility from a stroke adds discomfort. Anna determines also that environmental stimuli are disrupting his sleep. She evaluates whether a roommate or visitors, the presence of electronic equipment, could be a likelihood of the noise coming from the outside hallway. Anna also plans to assess Mr. Murphy's medications, carefully determine whether any of these drugs are adding to a sleep alteration. I wondered, what nursing diagnosis do you think? What would we do for the care plan for this patient? Once you do a thorough assessment and you look at your assessment data, you start to look at clusters of data that they have what's called a defining characteristic, and we're going to have a diagnosis of sleep pattern disturbance. If you identify a sleep problem, specify the conditions such as insomnia or sleep deprivation. Assessment also identifies the related factor or cause of the sleep disturbance. The nursing diagnosis is insomnia related to excessive environmental stimuli. Our goal is that Mr. Murphy will obtain a sense of restfulness after sleep in 1 month. And some expected outcomes for this goal. Manageable steps. Mr. Murphy will have fewer than 2 self-reported awakenings during the night. Mr. Murphy will report being able to fall asleep within 30 minutes of laying down. Mr. Murphy will sleep an average of 7 hours a night. Professional standards are especially important to consider when you make a care plan. As you plan care for someone with a sleep disturbance, you can also do a concept map, and I can show that to you guys how to do that. And you need to remember, when you do goals and outcome, you collaborate with the patient on what those should be. When patients have a chronic sleep problem, there's an initial referral usually to a sleep center. The nature of the sleep disturbance can determine whether referrals to someone else might be needed. Nursing interventions are designed to improve the quality of a person's rest and sleep would be focused on a lot of health promotion. We know that the patient needs adequate sleep and rest to maintain active and productive lifestyle. Patients benefit most from instructions based on information about their home and their lifestyle, such as which type of activities promote sleep in a night shift worker, how to make a home environment more conducive to sleep, and patients will appreciate information that is useful and valued. All patients require a sleeping environment with a comfortable room temperature, proper ventilation, minimal noise, a comfortable bed, proper lighting, eliminating distracting noise so the bedroom is quiet, and that includes turning off the television, the phone, or the clock, and the computer. Bedtime routines relax patients in preparation for sleep. It is very important for a person to go to sleep when they feel fatigued or sleepy. A bedtime routine, like the same hour for bedtime, snack, and activity, if you use it consistently, it will help young children go to sleep. Adults need to avoid excessive mental stimulation just before bedtime. Remember, older adults, if they're prone to confusion or falls, they may need a night light, their bed set in a lower area to the floor, and no clutter in the room. Don't forget about sleepwalkers. There are people who sleepwalk. They're unaware of their surroundings, they're slow to react, and that increases their risk for falls. Don't startle a sleepwalker, gently walk them back to bed. Infant beds need to be safe. You want to reduce the chance of suffocation. Don't put pillows, stuffed toys, loose blankets in there. Don't put a loose-fitting mattress cover. It's dangerous. An infant can pull it over their head. We now tell parents to put the infant on their back so they don't suffocate. In home, it helps to encourage patients to stay physically active during the day. Preschoolers often have bedtime fears, the dark, boogeyman kind of thing, and cultural tradition can often cause families to approach sleep practices differently. Some people enjoy a bedtime snack before bed. Warm milk has tryptophan in it, can be helpful, but a full meal can always cause, some people, the full meal causes GI upset and they are unable to sleep. Melatonin is a hormone produced in the brain that can help control the circadian rhythm and promote sleep. The recommended dosage is 0.3 to 1 milligram. There are several other herbal products that can assist: valerian root, kava, Chamomile, which is an herbal tea, has a bit of a mild sedative effect. The use of non-prescriptive sleeping medications is not advised. What you see here in the picture is what's called a CPAP, continuous positive airway pressure device. A person is wearing that when they have sleep apnea. It's one of the most effective therapies to help someone with sleep apnea. It's a mask. It delivers room air at a very high pressure. There are recommended lifestyle changes for people with sleep apnea, including good sleep hygiene, alcohol moderation, stopping smoking, and a weight loss program. Here we finish up with the case study. Anna, at the end of the month, Anna finds out that Mr. Murphy is falling asleep within 30 minutes of going to bed. He gets up 2 to 3 times a night, and he's getting around 6 hours of sleep a night. What would you write if you had to document this to show that they had met their outcome? If a nurse has successfully developed a good relationship with a patient and a therapeutic plan of care, subtle behaviors often indicate the level of a patient's satisfaction. Note the absence of signs of sleep problems, such as lethargy or frequent yawning. You are effective in promoting rest and sleep if the patient's goals and expectations are met.